I think that was undoubtedly the best cartoon and interpretation of Moses parting the Red Sea that I've seen. The last speaker for this track represents a startup based in a country that has consistently produced amazing medical innovations. Just go ask Medtronic. Assi Gol, a board advisor to Israel-based Sight Diagnostics. The company is bringing the most hyped technology of our time, artificial intelligence, to blood diagnostics. Please welcome Assi, who can share this story.
Pleasure to meet you.
Sorry, I can only do one thing at once, and I breathe most of the time.
Let me know because
I find this difficult.
Tickets, I always have season tickets.
Cool, we're on.
United.
And
So if you want to go.
so I've been introduced, Assi Gol. I spend most of my time working with with e-commerce on data, but I speak today in describing Sight. It's by far the most exciting startup I've had the opportunity to work with. I'm going to touch very briefly on kind of the trends that I think are shaping the diagnostic industry, and then I'll spend the bulk of the time talking about Sight. I think you've been trended out by now. So very briefly, when we look at the global diagnostic industry and what's really going to transform it, we see three things. The first one, AI and data. Both the algorithms that are shaping the patient decisions and the clinician's decisions, then the mass accumulation of data that is required to be able to feed those algorithms. And the third is the emergence, I think the imminent emergence of healthcare platforms, which will connect the algorithms and the data providers, the patients and the healthcare providers in one place. The second one is smaller, faster, easier. My premise is that anything that could be put into a smartwatch will go into a smartwatch. Anything that can be brought from a laboratory to a point of care will do that. It's just a question of time. Different diagnostic tests, different parts of the industry will move at different paces. And the third one, I will not elaborate at all because we have spoken about it at great length, but the importance of patients owning their own data, owning their own decisions, and taking their own actions. I think a good example, if you think of the diagnostic industry, of something that combines all of those things, is if you look at an Apple Watch that generates an insane amount of data, that takes action based on that data. It is smaller, it is easy, it is simple, and we're the first EKG over-the-counter solution sold directly to consumers. So just these are the general trends we see. Now I'll describe why blood testing has to change through my experience. I am a father of 4 young kids, and as a father of 4 young kids, at any point in time, one of them is sick. And when they're sick, sometimes you don't have to do anything. Sometimes you end up going to the doctor. And the ritual is almost known in advance. The doctors check their throat, check their temperature, check their breathing, and at a certain point it becomes very, very clear that they don't really know what your child has. They think that in all likelihood it's viral and you should just go home and let your child rest, but there's no real way for them to get to a conclusive diagnosis. What they do sometimes, if they so choose, is to suggest that you go for a blood test, a blood count. Often it is the afternoon, the lab is already closed, you come in the following day, the phlebotomist, the nurse, takes blood from a very unhappy child. Then it's sent to a central laboratory. Hopefully the following day you either have to come in again or on a phone call realize what was the diagnosis that you wanted to receive 2 days ago. It is almost as if you compare it It's almost as if you would come to a doctor who would say, I'll know your blood pressure in 2 days, and then I'll tell you what I think you've got. It's a completely wrong way of treating patients, and it leads to wrong decisions and very bad care. Which leads us to complete blood counts. It is by far the most common blood test, around 4 billion done annually globally. The largest market is naturally the US, but it is really a global test done in every single country in the world. And it is critical for a lot of things. It is important for diagnosing, like I mentioned earlier, whether an illness is viral or bacterial. It helps with early diagnostics of cancers, anemia, etc. It is, and all that it is, I'm sure that most of you would know much better than I am, but in case someone is unclear, a blood count is just counting the different cells that you have in your blood and comparing it to standard numbers that physicians are expecting to see. The shift that is required then is shifting those CBCs from a lab to a point of care. If you look historically, the way these things used to work is you take blood, you put it under a microscope, and you count the different cells. Around the 60s, 70s, technology called flow cytometry allowed to create very complicated, very impressive pieces of kit that are now used in every single laboratory, large hospitals, etc. Those are very expensive machines, require specialized capabilities, required a lot of training. They require chemicals, daily and weekly calibrations. They are completely unsuitable for anything but a central laboratory. What we need is something that fits a point of care, which is simple, affordable, small, which leads us to Olo. This is a device that has been developed by Sight Diagnostics. It's a company that has been around since 2011. It uses computer vision, which is a subfield of AI, to do basically what a doctor used to do under a microscope, which is look at the blood, count the different cells. It just does it for you and does it at the point of care.
I'm going to go to starts in an hour.
Okay.
How does the process actually work? There are basically 3 steps. You come, it starts with a small finger prick, taking 2 blood drops into a cartridge, a patented cartridge that creates a monolayer of blood. The second step is taking that cartridge and putting it into the device. It spends around 9 to 10 minutes to scan it. It's basically microscopes taking around 1,000 images of the blood sample. And then the third bit is the actual algorithm. As the scan is happening, the algorithm is in a live way counting and differentiating all your different blood cells. Where are we from a R&D and regulatory perspective? To be able to do something like this, it has to deliver lab-grade results, or a doctor will not count on it and will not use it. We are in the middle of clinical trials in Boston Children's Hospital and Columbia University, and the results are perfect. We're looking for equivalence with Sysmex, top-of-the-line lab-grade machines, and we're seeing at every level, on every type of count, fantastic results. We're incredibly positive that we will get to FDA clearance by mid-2019. This is not the first product that Sight brought to market. We actually started from something quite different. The company was created to use computer vision to do exactly this, to identify malaria in blood. This is a perfect example of a trickle-up innovation, I think, that was mentioned yesterday, of when you develop a device for emerging markets and bring it back to these markets, you have a very different set of advantages. Malaria, though it sounds like something of the past if you're here, is still one of the worst diseases plaguing places like Africa and India. The World Health Organization estimates around 400,000 people die from malaria every year. The parasite, which is the first product that Sight has released, has been sold in over 25 countries. It works in a very similar way. You take a blood sample, you put it in the device, it scans it. It just doesn't look at blood cells. It tries to find the parasite, the malaria parasite within your blood. The way that malaria tests work today in Africa or in India is there are kind of two extremes. One is that you can look through a microscope and actually find the parasites in the blood. That's very accurate, very expensive, and very slow. There are also tests that are very quick and very inaccurate, very quick and very cheap, but are very inaccurate. And Parasite sits at the both affordable and perfect accuracy. This is peer-reviewed, this is open. I'm very happy to discuss this. As the company was developing this, we realized that the machine learning algorithms, that the deep neural nets that have been built to identify this are able to differentiate different blood cells, that the resolution we're getting to will allow us to crack CBC, and that's what led to the development of Olo. I cannot take any credit for all the smart technology in this device. There's a bunch of very, very, very smart R&D people working on this. Most of them are physicists, mathematicians, there's doctors and biologists. There is a very strong leaning to data science, and I don't know if any of you know, but those Israeli army teams that generate great R&D talent, this is a very, very heavy slant towards Talpiot, which is probably the best R&D unit in the Israeli army. If I go back to the trends I briefly touched on in the beginning, I think Olo is a perfect example for a diagnostic tool of the 21st century. First of all, it creates an amount of data that has never been accessible before. You create a database a visual database of blood samples that can be used for far more than blood counts in the future. And you store that data, and that allows you to get to predictive medicine, as we've been discussing. It also uses AI both for the algorithm, but will allow to feed other AI decision-making tools. It is clearly smaller, faster, and easier than the existing approaches of sending blood samples to a central laboratory and getting it back. And whatever the path that we will choose to bring this product to market, whether it's for a doctor's office or a pharmacy or an emergency room, a core principle is that patients should own their own data. It is theirs, and their ability to then share it with whatever other platform that they choose will allow them to gain much more value than just a generic blood count out of this. This, by the way, is a picture coming out of an Olo device. The Olo device already can do malaria and complete blood count in one device, in one go, in one test. We're already working on multiple future developments, being able to identify different types of anemia, different types of cancer early on in the blood. So this is really just the beginning. Just to summarize, 8 years or so, Sight has been in existence. The bulk of this time has been spent developing technology and then we are very close to achieving the regulatory status that we need. And I think the next very, very exciting stage is commercializing it and bringing the great impact it could have to systems around the world.
So we have a little bit of time. If anyone in the audience would like to ask a question, I have a mic here ready for you. I'll come down to you.
Yeah, thank you. It's a very nice device. I'm just wondering if this CBC is a 5-part CBC or 3-part CBC.
It's 5 diff.
Okay, thank you.
And
besides this CBC, what do you planning any other tests follow this?
we have many future development plans for the future. We're currently focusing on bringing the CBC to the market.
Okay, CBC is the first.
Is first, yes.
Oh, okay, thank you.
Anyone else?
I don't mean to have this sound negative, but after the debacle of Theranos, for those of us who are not in the field, we
I'm sorry, could you repeat?
After the debacle of Theranos,
Yes.
what we see for these types of applications is viewed with a certain amount of skepticism. Can you give us your insight on how you as a company are approaching the problem?
Yes. So look, it's for me, it's almost complete opposites. Theranos is clearly a big shadow that we live with. It makes far more people know about blood tests, so it's quite good. But it also makes everyone very, very skeptical, which is also good. I think the differences are, first and foremost, this is not, Theranos is very unique in being a very well-intentioned company that ended up going on a very, very evil path. This is not the case here. I think second is there is incredible focus in this. You've asked me earlier, what are the next tests? There are many things that we could do with this. We're focusing on nailing CBC perfectly. Theranos, we're aiming to do around 150 tests in a single device. So it's while I think the levels of future ambitions are very aligned, the steps that we're taking to get there are very different. The third is we're not playing regulatory games. We could also put the device tomorrow in the market and say that we have a central laboratory that is clear, approved. That we're not doing it. We're working closely with the FDA. We're doing peer-reviewed research. There's nothing shoddy and weird about this. So the first time I tried it, I just went and took my blood tests in the equivalent of an NHS in Israel, and then went and took my test on a Sight device and compared it for myself. I think the first time that people will have the opportunity to do this at scale, that they will see that the results just speak for themselves. So we're not worried.
I think great question and great answer. I think clinical validation is going to get over that Theranos dark cloud.
Yes.
Any other questions?
My question's actually for Naresh and his presentation. And I guess my question is, from the greater Manchester region, is the UK looking at pushing resources down to regions to handle it? In essence, as you pilot it, is it the model for the rest of the UK, or are you the anomaly from the experience, or what's the measure or test from the output and the results?
Locally, we decided what the outcomes were with national. So we decided that there were things around mental health, eradication of hepatitis C, homelessness. Those are the things, the big ticket items, as we call them. Diabetes, I managed to squeeze in. Took an opportunity when I met the chief exec and said, well, I think we need to do diabetes, so we squeezed that in. So I think if Manchester succeeds, I think the other places are actually applying to devolve. So I think they're all waiting to see what happens with Manchester.
Any more? Well, I want to take the time to thank all the speakers. And the audience as well who stuck around. So there were many great lessons learned in this track, but 3 that stuck out for me were, it's not just about the social determinants of health, political determinants of health matter too. Understand and love logistics and what it can do for healthcare. And my favorite, next time you crave a bag of chips, just lick the outside. Thank you all, and the NPR panel is in Hall E at 5 o'clock. Thanks.
Good.